Okay, hi. Assalamualaikum warahmatullahi wabarakatuh. My name is Muhammad Hafiz Manafindi. My metric number is 2020880728. I'm from RSA 134A. Okay, today our group and I would like to present about the video analysis in shooting for basketball. Okay, now for the introduction, I would like to share a little bit about the sport of basketball. Basketball is a team sport in which two teams typically consisting of 5 players each face off against one another on a rectangular court with the main goal of preventing the opposing team from shooting through their own hoop while putting the ball through the defender's hoop at each end of the court. Okay. The rules of this sport is the player must move the ball forward by either passing it to the other teammates or bouncing it while running or walking, also known as dribbling, both of which require a high level of ability. Player can take the ball from the dribbler, and the player who had a foul and the player who chosen to attempt a technical foul is awarded 1, 2 or 3 1-point free throws. Okay, now I would like to present about the importance of shooting in basketball. Shooting is the most important skill in basketball. Why? Because everyone need to able to make a shot, because this will give the point to their teams. Okay, usually there have 3 phases for shooting in basketball. For the first phase is preparation phase, second is execution phase, and third is follow through phase.
Hello, Assalamualaikum. My name is Muhammad Irisha bin Muhammad Ali. My metric number is 2020871226 and I'm from class RSR 11348. So in this video, I will explain a little bit about the preparation phase. So let's move. Okay, now we move to the muscle involvement in preparation phase. The first muscle that involved in preparation phase is gluteus maximus muscles. This muscle is located at the buttocks. These muscles will contract when the athlete bends slightly their legs in squat position. This muscle help to extend the hip lower to make sure the athlete is stabilized before jump. Next is quadricep muscle. This muscle is located at the front of thigh. The function of this muscle is to strengthen the knee joint during a jump. This muscle also the most important because it determines how high the athlete can jump. Next, the third muscle is hamstring. This muscle is located at the back of thigh and also it works with quadricep muscle. The function of this muscle is help the athlete to bend the knees and lower their body to make sure the athlete can get the momentum before do a jump. And the last muscle is calf muscles. This muscle is located at the back of lower leg. The function of this muscle is to push your leg to jump higher. These muscles enable you to make a movement, especially on the lower leg.
Assalamualaikum. My name is Muhammad Hakim Abdul Rahim. My metric number is 2020453812. And now I will explain about bones involvement. And the first bone is from elbow, it called humerus. The bone is upper arm that located between the elbow and the shoulder. The function is to provide support for shoulder and a wide variety of movement for arm. As we can see, while the player is ready to shoot the ball, the bone of the player is already bent because need to be ready for throwing or shooting the ball through the basket. For the second bone is at the shoulder, which is the scapula. The scapula, or it's called plural scapulus, it is also known as shoulder bone, shoulder blade, wing bone, spill bone, and blade bone. The bone is connected to the humerus, which is upper arm bone, with calvi, the collarbone. And from the picture, the players will bring the ball higher than his body.
Okay, now we move to the joint movement terminology in preparation phase. There are 3 joint movement, which is number 1 is elbow flexion. Elbow flexion happen when the athlete bend their hand before throw a ball. This flexion will help the athlete push the ball into the hoops. During this flexion, the athlete also can get a momentum from their hands to make an accurate shot. Next is hip flexion. Deflection is happen when the athlete lower their glutes muscle and their body slightly move forward. This flexion will help the athlete stabilize the core of their body and make them feel in a good position to make a jump shot. And lastly is knee flexion. Knee flexion happen when the athlete bend his leg to do a jump shot. This flexion will make the athlete have more control of the ball. During this flexion, the athlete also can get a momentum from their legs to make a powerful jump.
Next is SYNOVIAL joint that use. The first joint is hind joint. It is a type of joint that function much like the hind on the dog. It is also allowing bones to move in one direction, back and forward, with limited motion along other planes. The fingers, toes, elbows, knee, and ankle contain hind joint. And for the next joint is the ball and socket joint, and it also calls spurious joint. It is a type of synovial joint in which the ball-shaped surface of one rounded bone fits into the cup-like depression of another bone. The distal bone is capable of motion around an indefinite number of axes, which have one common center. And that's all for me. Thank you.
Okay, Assalamualaikum. My name is Muhammad Afi bin Abdul Halim. My match number is 2020471418. So now I will continue with the education phase. First, we start with the muscle involved. The first muscle involved is wrist extensor. Forearm muscle, move the wrist and control the opening and closing of fingers. The flexor, digitorum profundus, runs from the elbow to the wrist where it connects to muscle in the finger. The muscle helps the generate force required to push your finger forward when shooting the ball. It works in conjunction with the tricep muscle which extends your arm. The second muscle that involved is elbow. Tricep extends the elbow during shooting, while bicep flexes the elbow for aiming and returning the arm to its normal position. And third, shoulder. The trapezius, which is located at the collarbone, and the deltoid, which surround the joint of the shoulder near the arm, are the primary shoulder muscle involved in shooting a basket. This muscle help to raise your arm and rotate your shoulder as you aim and shoot. Okay, next I will continue with the bone involvement. Okay, the first bone involved is carpus. The carpus bones are bone of the wrist that connect the distal aspect of the radial and ulnar bones of the forearm to the base of the 5 metacarpal bones of the hand. Okay, third is radius. The radius or radial bone is one of the 2 large bones of the forearm. It extends from the lateral side of the elbow to the thumb side of the wrist and run parallel to the ulna. And third, humerus. The humerus is the bone in your upper arm that's located between your elbow and your shoulder. Its main function to provide support for your shoulder and a wide variety of movement for your arm. So now I will explain about the joint movement. Okay, first is the wrist extension. Wrist extension is movement of the hand backward toward the posterior side of forearm. Third, elbow flexion. When your forearm moves toward your body by ending of your elbow, it's called elbow flexion. The opposite movement is called elbow extension. And third, plantar flexion. The term plantar flexion refers to the movement of the foot in a downward motion away from the body. Okay, next, I will continue with the synovial joint. The first is condylate joint. The condylate synovial joint of the distal upper limb that connect and serve as a transition point between the forearm and hand. Condylate joint is a modified ball and socket joint that allows for flexion, extension, adduction, and adduction movement. Okay, for the second is hinge joint. The elbow joint is a synovial hinge joint, similar to the ankle and knee joints. Two or more bones from hinge joint that move along an axis rather than rotate like the hip joint. The distal humerus and proximal ulna are the primary elbow joint bones. The hinge joint allows the elbow to bend and straighten. Okay, third is ball and socket joint. The shoulder joint is a ball and socket type synovial joint. The very shallow gallina cavity of the scapula and the large humeral head endow the shoulder joint with the greatest degree of the mobility of any joint in the body.
Hai, Assalamualaikum warahmatullahi wabarakatuh. My name is Muhammad Fatil Hadi bin Muhammad Usri. My entry number is 2020-871352. Today, I will explain about the follow-through phase in a shooting basketball. Follow-through phase is an important biomechanical technique in order to achieve its optimal accuracy in a shooting. Now we go to muscles involvement in a follow-through phase in shooting basketball. First, we have a deltoid, tricep, hamstring, and the last one is gastrocnemius. Deltoid uses to help to raise your arm and rotate your shoulder after shooting a basketball. Meanwhile, the tricep is used to extend your elbow while shooting. For the lower parts of body, we have hamstring and gastrocnemius. Hamstring and gastrocnemius is a both muscle are required to absorb the impact while landing after a shooting skill. Now we go to the bone involvement. There are three types of bone involved in follow-through phase in shooting basketball, which is scapula, radius, and humerus. Scapula is a bone that connects to the humerus, is responsible for the internal and external rotation of the shoulder. Humerus is an arm bone between shoulder and elbow, which is contribute to the movement of the hand and elbow. Radius function as to help to aiming while shooting in basketball.
Okay, now it's my turn to explain about the joint involved in this phase. Okay, for the first is hinge joint. Acts to perform to flexion on the elbow, which is caused by the bicep act as an agonist and tricep act as antagonist. This movement will occur to help to push the ball through the hoop. Okay, now next is the ball and socket joint acts to perform flexion on the shoulders. Okay, when the arms move upwards from the rest position, this movement helps to push the ball towards the hoop and helps to improve and accuracy of shooting. Next is hip joint. Hip joint will extended because of the ball and socket joint. It helps to stabilizing the core of our body and also helps to absorb the impact after we do the jumping shot. Next is hinge joint at the knee joint, acts to absorb the impact after we do the jumping shot. That will extend our knee. This movement also can reduce the risk of our injury for the athletes after the action. For the last joint is ankle joint, acts to help with make the momentum to throw the ball towards the hoop and also helps the knee or the ankle to absorb the impact of the jump shot. Okay, now I would like to present about the joint movement terminology. For the first is shoulder flexion. Shoulder flexion occur when the arm move upwards from the rest position with the shooting shoulder position in 140 to 150 degrees of flexion. This action occur after the person shoot the ball into the air. Okay, now for the next is elbow extension for the right hand and elbow flexion for the left hand. In follow through, this action occur after the person shoot the ball and cause the angle of the joint increases in right hand. And for the flexion is the action occur after the person left hand or supporting hand helps to stabilizing the ball in follow through. This action occur when the person release the ball through the hoop. Next is hip extension. Hip extension occur when the person feet is already on the floor after performing a jumping shot. It helps to stabilizing the core of our body and absorb the impact after we do the jump. Next is knee extension. Knee extension occur when the person does a jump shot and it will help the person to get injury after he do the jump shot. And for the last leg is ankle plantar flexion. For plantar flexion of the ankle joint occur after the person leg already on the floor after he or she do the jump shot. This action helps the knee joint to absorb the impact after we do the jump shot.
Okay, now we move to the recommendation to improve performance in basketball shooting. So, firstly, I recommend the athlete to focus on their stance. It is to make sure the athlete become more stable before making the jump. Next, the athlete should strengthen their grip. This because to make sure the ball does not slip out of their hand, and the athlete also can control the throw of the ball. And lastly, the athlete should improve their jump. It is because jumping is the most important thing in basketball. So high jump can ensure that the athlete can score goal more accurately. That's all from me. Thank you.
Now we go to the conclusion. As conclusion, shooting skill one of the important skill in basketball. There are three phases of the shooting in basketball, which is preparation phase, execution phase, and the last one is follow-through phase. The knowledge of biomechanics helps the players, coaches, and related persons to enhance their basketball shooting skill. This principle tells us how our body move efficiently, improve our skill, and rectify faulty action. It also helps to prevent any injuries while execute the skill. That's all from us. Thank you.